This man shot to fame with a TV series called Moonlighting. Then, trust me, you see this movie called Die Hard and you'll be a fan forever. Followed it with some amazing movies like The Sixth Sense, Unbreakable, The Armageddon, The Expendables in the recent past, and many more such amazing movies. Somebody who made bald look cool. Somebody who got married to one of the most beautiful females. So I'm talking about Bruce Willis. And recently I came to know that he retired from acting. And he retired because of a medical reason. He said he was suffering from aphasia. Now, if you think about it, aphasia by itself is not a disease. It is a symptom. Now, what is a symptom? To help you understand better, fever is a symptom. Now, fever could be because of so many things. It could be because of a simple flu. It could be because of malaria. It could be because of typhoid. It could be because of cancer. It could be because of appendicitis, cholecystitis. It could be because of multiple reasons. But it's just a symptom. So, fever by itself does not become a disease. Similarly, Bruce Willis, all that we know, is suffering from aphasia. So, I will try and decipher what exactly aphasia stands for and what could be the probable cause for it for you. Now, aphasias could occur in different forms. So, it could be a sensory aphasia, motor aphasia. Those are the technical aspects of aphasia. Largely, it means involvement of your speech. So, difficulty in understanding or in your speech output is called as aphasia in simple terms. So, when a person speaks to you, you're not able to either understand what he's trying to tell you or you're not able to respond to him in the right words. So, a combination of all these things is aphasia. Aphasia could be reversible. Aphasia could be something which is permanent but non-progressive, and aphasia could be something which is progressive. So, when it comes to the reversible forms of aphasia, it is largely things like migraine. So, in migraine, there is a sudden episode of headache, which if it involves the speech area, then there is sudden loss of speech, but in almost all instances, the speech comes back. So, it is reversible. Similarly, in patients with seizures, there is an episode of fits, and then immediately post-ictal stage, there is aphasia, but then the patients usually recover completely. So, that's a small set of patients with reversible forms. In fact, even in patients with brain tumors which are lying outside the brain but compressing the parts which are responsible for our speech, causing swelling around that. Once that tumor is removed, the speech comes back to normal. So, even in brain tumors, the aphasia could be reversible. The second would be the ones which are non-reversible, but these aphasias are non-progressive also. So, imagine a scenario where there is head injury. So, there is trauma to the head. So, whatever parts are injured and a particular aspect of speech is lost. So, it doesn't come back as such, but then it doesn't progress either. Similarly with stroke, if it involves a speech area, your speech would be affected and it does not progress either unless there is another episode of stroke which involves another part of the speech area which was previously not involved. So, this would be the non-progressive. And thirdly would be the progressive ones where the speech deficits continue to deteriorate over time. So, this usually happens in patients with dementia, patients with Alzheimer's. So, they continue to deteriorate over a period of time. So, let's hope that for Bruce Willis himself and for all the fans across the globe, the aphasia that he suffers from is not because of some really bad or irreversible cause, and let's hope that he makes a comeback to the silver screen and is able to mouth those amazing one-liners and those really powerful dialogues again. Thank you.